Welcome back to the special NHI webinar brought to you by Alex Forbes, and we've heard some very interesting views so far from Catherine Brown, MD of Benguela Healthcare, on the broad structure of the NHI and what it proposes in this version and what's changed from the 2019 version of the bill. We've heard from Dr. Matudi, the MD of the Board of Healthcare Funders, on the private medical scheme view, and Neil Kirby, our legal expert, on some of the constitutional issues that are raised and might be ventilated more broadly in the panel. The question now, Buchi Tlali, welcome back, is what this means for employees and employers.
Michael, there is no doubt that NHI, when implemented, will have a significant impact on employers and employees. Our advice framework remains very relevant because it's designed to truly understand the impact on benefits and the strategy that one implements at that level, how that aligns to your people strategy and ultimately organizational strategy. There must be cohesion within the organization. So at the very least, employers need to continue to ensure that that alignment remains in place. Secondly, over and above that, it is also about group benefits and the importance of that in our ability to offer a value proposition that resonates. The ability to not just attract but retain talent, and that war for talent is vicious and goes across even the borders of the countries that we have. If there's anything that we learn from the experience of COVID-19, and I think Dr. Mutui mentioned it as well, it is just the cost of inadequate healthcare. And one needs to ensure that that remains in place. But I guess for today, there are two specific policies that I would like to focus on. And it is our policy as it relates to participation in group benefits, and then maybe briefly touch in terms of what the subsidies and so forth. So this debate on compulsory versus voluntary participation is not new. It's not a new one. And it's one that I would imagine no business leader ever goes through a town hall without somebody challenging, what are we doing on medical schemes? Be it the cost, can we introduce more affordable things? Are you going to subsidize it, and so forth? Therefore, it is important that for an organization that has got that alignment that I talked about, that is embedded in terms of our own advice framework, it is important to ensure that that participation policy, it's well understood and embedded in terms of the governance structures within organization. If we fail to do that, in many ways it makes it susceptible to perhaps whimsical changes and changes, because it is a hard one to maintain, because there's so many pressures that that employees are faced with, and so forth. So what is very clear is that our contribution towards that NHI will be there. It will be compulsory. Therefore, we urge employers that have employees that are not contributing to any form of healthcare cover to begin to align, to begin to find options that are affordable, that begin to ease that in, and people get used to that notion that at some point we will, as employed people, begin to contribute towards some form of cover, and so forth. And what we also know that the second layer of cover, which is medical schemes, I would even say gap products, that in our view will remain relevant, because everything that we've heard so far in terms of that NHI package of benefits, initially it will be incremental in its introduction. It will probably initially be focused on primary healthcare. But what we know is that the greatest risk that we face is not necessarily in primary healthcare, but when things go majorly wrong, major medical cover, and generally that we expect will continue to be offered through medical schemes and even gap cover, as we talked about. So that layer, again, employers need to be very clear and provide leadership that is necessary to decide whether, what is our participation policy? Are we going to continue to make it compulsory to the extent that we understand the risk of having people that are not covered? Because NHI will not necessarily offer such benefits initially certainly at the onset. So I think Catherine mentioned it very clearly. There will be a new category of tax that is related to NHI. We can expect that to come through. The quantum and structure of such NHI tax, I would say at this point is not known, but it's one that we can already begin to anticipate. And part of our advice process in here, it is holding employers' hands along this, is scenarios, it is modeling around what the impact could be, and all of that obviously is available through an employer. Interestingly, one of the questions that came in was, what is the role of advisors in this space? We can tell you, well, our view is that the complexity is likely to increase, certainly at the onset, and obviously such modeling is available to employers should they need to get into that. Then the second aspect to this, and it's a very short one, is raised to do with subsidies. And subsidies are ultimately about affordability. How affordable would this be? And we talked about the need to have a value proposition that is strong, that resonates, that allows you to be able to retain the talent that you need to deliver on your overall strategy. What we also know that depending on what your overall participation policy is, it will make it, it will allow medical schemes or insurers over and above NHI to decide in terms of what the conditions of acceptance will be for your employees coming into that. So obviously there is different structures of remuneration. There's a move towards total cost as opposed to benefits. In our view, it is kind of looking at two sides of the same coin. No structure is necessarily better than the other. It is just a different way of structuring that. However, when it comes to the cost of healthcare post-implementation of NHI, or even at the initial introduction of NHI, it could be very different. The impact could be very different depending on what the benefit package looks like and the decisions that you make as an employer around that. Firstly, it could be neutral if one substitutes, if I can use that word, that benefits package for what you have within a medical scheme. Perhaps it could be neutral. Perhaps it could be more affordable, as other people have purported, because NHI, because of the large risk pools, it could be more affordable to for members. Alternatively, it could be more expensive if there is duplication of cover between what NHI is, because by its nature it will be restricted. If you do not stick to those referral paths that we talk about, does that mean that you now, that is something that a private medical scheme would offer? And if so, that could come at an additional cost. So employers, as part of their own remuneration strategy and approach, would have to decide whether they cushion some of this through a subsidy or not. But ultimately, it is about the total cost of employment, and that will come through one way or the other, whether it is through employees or whether that is subsidized by employers. So perhaps, I guess, for us, the issues that employers need to consider now, first and foremost, is do not panic. There is a bit of time to get our heads around this. The times that I've heard range anything from 5 to 10 years. I've even heard much longer time frames be talked about. It is about being clear in terms of your organizational strategy and alignment to that. It is ensuring that you've got the right support around you as you look to execute on this strategy. And as we said, it is also about maybe finding that policy shift that begins to get our own employees' head around the fact that there will be some form of mandatory contribution, and let us begin to align with that and get things going. And lastly, for us, is also to say benefits, flexibility of benefits becomes even more important because now you will have to contend with another layer of benefits through NHI and possibly top-ups that will come from private medical schemes as well.
It sounds like we're almost moving to a three-tiered system, but we'll debate and discuss that on the panel. Buchi Tlali, sure. Executive Consulting at Alex Forbes, thank you very much. We're going to have a panel debate and discussion on this after this short break.